2 almost 3-year-olds. As a mother of a 2 almost 3-year-old, California reopening on June 15th probably won't change much about how we're already behaving. Even though my partner and I have already been fully vaccinated, we will continue to mask in public spaces and at work. We are lucky enough to have my mom to watch our daughter during the day when we're at work, so we don't have to worry about daycare at the moment. But we are also limiting playdates to those families who have fully vaccinated parents. We aren't afraid of our daughter getting super sick or hospitalized, but we are conscious of the potential spread of the virus to those who wouldn't be as lucky. And while the risk is low, we are also considerate of the long-term health complications that come from getting sick from COVID-19. And as a parent, we're doing our best to minimize that risk to our child.
What's your name?
Marley.
How old are you?
11, soon to be 12.
And what do you think about California reopening today?
I think it's good and bad because large events that are indoors, you should still have to wear a mask because you're close to people and there's a lot of people if it's full capacity. Grocery stores and shopping areas like malls and all that. I think it's good and bad because some people don't wear their mask correctly or just don't wear it at all, which is kind of good and kind of bad because some places you still should have to wear a mask, and like stores, it's good because people barely wear their masks in there and they don't wear them properly.
Themes, y'all. I'm Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spittin' Quarantino, aka I wear my sunglasses at night because my eyes are as sensitive as my heart is, y'all. And welcome to Masked Up Unmasked for the first time officially. How are y'all feeling about it? We feel a lot of different ways based on our experiences. So I just want to make sure that we are extending maximum grace to both ourselves and others as California reopens and we hit reset on our daily lives, y'all. No matter what side of any number of issues that you might have been on the last year that we might disagree about, we all went through a collective trauma together and it is time to heal. So let's make sure that we're being gentle with ourselves and each other as we come back, y'all. While California is reopening, this does not mean COVID is over, especially for the rest of the world. Tonight, we're going to cover some of the variants that are coming out of other parts of the world and the effects that they are having. We will also be talking to Dr. Jeffrey Reynoso, Executive Director of the Latino Coalition for a Healthy California, about the effects of COVID on the Latinx community. So stick around. It's another information-packed episode of the internet's favorite community health live stream, and it starts now. If you don't know by now, I'm not sure where you've been, but California is back open. Mask mandates are a thing of the past, at least if you're vaccinated and not a liar. Governor Newsom was out in Universal City yesterday to make the big announcement. Here's some coverage from ABC 7.
The full reopening of the California economy. We are here, June 15th, to turn the page, to move beyond capacity limits, to move beyond these color coding, move beyond social distancing and physical distancing. And yes, as you saw me walk up the stage, move beyond mass.
And the governor and other officials here say that the vaccination efforts do not end now. They're now trying to reach out to some of those hard-hit communities, some of the hard-to-reach communities, to try to get as many people as possible vaccinated.
This story comes to us from Jane Greenhalgh at NPR. The Delta variant, which was first detected in India, now accounts for more than 6% of all infections in the United States, according to the CDC. And this highly transmissible variant may be responsible for more than 18% of cases in some Western U.S. states. The variant, also known as B.1.617.2, is spreading rapidly in the United Kingdom and has quickly become the dominant strain there, responsible for more than 90% of infections and causing surges of COVID-19 in some parts of England. We cannot let that happen in the United States, Dr. Anthony Fauci said. Speaking at a White House COVID-19 briefing Tuesday, Fauci warned that the Delta variant may be associated with more severe disease and a higher risk of hospitalization. The good news is that the vaccines look like they can protect people against the Delta variant. A new study from Public Health England showed 2 doses of the Pfizer-BioNTech vaccine were 88% effective against symptomatic disease from the Delta variant, compared with 93% effectiveness against the Alpha variant, the variant first detected in the UK. The vaccine only provided 33% protection after just 1 dose. Fauci urged everyone who has received the first dose of the Pfizer or Moderna vaccines to make sure to sign up for a second. And for those who have still not been vaccinated yet, please get vaccinated, he said. He said vaccination is the best way to protect yourself and to stop this variant from spreading and becoming dominant in the US. So we keep talking about all these variants, but what are variants and how do they work? Let's dig a little deeper into that with our friends at Nature Video in this week's It's Called Science.
Viruses multiply by copying their genomes over and over. But like an old photocopier, these copies aren't always perfect. Each of these imperfect copies is a variant. Normally, the imperfections or mutations don't change how the virus behaves, and they can often make it less successful than the original strain. But very rarely, mutations can change the virus in some important ways. It could become more infectious or more able to avoid the immune system. The more a virus is allowed to replicate unchecked, the more chance it has to accumulate these rare beneficial mutations. That can occur when viruses are allowed to spread quickly through a population, or if they encounter a host that's less able to fight them, such as people with compromised immune systems from medical treatment, or those who are HIV positive. If a particular set of mutations makes a variant more successful, it might become more prominent than others, and that's when it gets noticed. Epidemiologists may even decide to label it a variant of concern, like the examples identified in Brazil, South Africa, and the UK. For months, scientists have been striving to work out what's changed in these variants and what those changes mean. Because a variant spreading doesn't necessarily mean that it has an advantageous mutation. For example, a small number of people could, by chance, move a variant from one region to another, like tourists travelling back from popular vacation spots. This could cause that variant to start spreading in a new location, even though there may be no significant change to the biology of the virus. This is called the founder effect. Understanding why a variant has emerged requires a combination of studies. Epidemiology can help detect and trace new variants and flag new or worrying patterns of infection. Meanwhile, lab studies can start to pinpoint how the mutations are changing the properties of the virus. And studies like these are starting to identify mutations that have given the virus an upper hand. Some variants are faster spreading, and there are hints that certain mutations could start to weaken or even evade natural and vaccine-derived immunity.
As our guest, Dr. Jeffrey Reynoso, will tell us tonight, the Latinx community was hit especially hard by COVID-19, but why are they more susceptible than their white counterparts to the virus? As always, structural racism goes deep. Check out this video from Now This.
It matters because people with common health problems like uncontrolled high cholesterol or obesity or diabetes also have a weak immune system. Any person you know with uncontrolled diabetes, high cholesterol, and obesity are at higher risk of not only getting COVID, but also have a weaker immune system to fight COVID. And we know that many people of color happen to have higher rates of high cholesterol, obesity, and diabetes. Putting this all together, communities of color have higher rates of health problems, which lead to a weaker immune system, which leads to higher risk of COVID infection and a higher risk of death. So why is this important? Racism. Racism is one reason why people of color end up with these underlying health problems in the first place. And therefore, racism increases your risk of COVID-19 infection. I'll explain how. Act 3. How does racism increase a person's risk of dying from COVID-19? I think we all agree that experiencing racism is stressful. And increased stress happens to increase your risk of diabetes, obesity, and high cholesterol. Stress does this by activating the fight, flight, or freeze system, which is the same pathway in our brain that was designed to be used when we face danger, like running away from a tiger. When the fight, flight, or freeze pathway is activated, it releases stress hormones. One of the most well-known is called cortisol. These stress hormones increase the risk of high cholesterol, obesity, and diabetes by telling your body to recruit sugar, which causes diabetes, and fat molecules, which causes high cholesterol. High amounts of sugar and fat in the blood lead to obesity. So stress hits the on switch, so the fight, flight, or freeze response is turned on longer than it should be. And if the fight, flight, or freeze response is turned on longer than it should, so are the hormones which dysregulate the whole system. Stress hormones end up being released when they shouldn't be, leading to increased recruitment of fat, sugar, and other unhealthy body responses because the brain thinks you're in danger and you don't have energy to waste to break these things down. So experiencing racism increases the fight, flight, or freeze system, which increases the risk of getting high cholesterol, obesity, and diabetes. And experiencing racism increases stress, which leads to increased risk of these health problems. And because people of color have higher rates of these health problems, they're at higher risk of infection of COVID-19 and a weakened immune response to fight it off. Racism, y'all.
Our guest tonight is the executive director of the Latino Coalition for a Healthy California and has worked on health equity and social justice issues for the past decade as part of the Uninsured Project, Governor Newsom's Master Plan for Aging Equity Work Group, and the California Department of Public Health's Community Vaccine Advisory Community. He was the first Latino to receive a Doctor of Public Health from the Harvard T.H. Chan School of Public Health and is dedicated to health equity for the Latinx community. Dr. Jeffrey Reynoso, y'all. Dr. Reynoso, how are you doing?
Doing well, Andrew. How are you?
And I'm so excited to have this conversation. All of our guests are very accomplished, very astute people, and you are no different. You were the first Latino to receive a Doctor of Public Health from Harvard School of Public Health. What inspired you to devote your life to public health advocacy?
Well, thanks for the invitation and to be able to speak to your audience here tonight. You know, I think for those of us that do health equity work or advocacy work, we all often say that the professional is personal. We have a personal lived experience of being marginalized at the margin. So I'm a son of immigrants, grew up primarily in the Central Valley, inland North San Diego County. So just encountering all of those systemic barriers, within my own family with different systems, be healthcare, education, all of that, kind of instilled in me a desire to improve my family's life, also my community's life. I think for those of us that are able to, be in the right place at the right time sometimes and get the right mentorship, and we're able to, get out, as they often say, and be able to, get an education, get a job. It really gives you a different perspective, and you feel an obligation to give back. And I do this work out of love for my family, my comunidad, and that's really what inspired me to get into health policy advocacy.
Mm. And so, from your experience working as the executive director of the Latino Coalition for a Healthy California, what are the greatest health challenges impacting the Latino community today, and what can we do to solve them?
Yeah, a lot of challenges, and I also call them opportunities for the state of California in particular. With LCHC, just to share a little bit about our organization, we are the state's health policy advocacy organization, advancing health equity for our state's Latinx community. Latinos represent, depending on what numbers you look at, 39-40% and 40 million Californians. So we're a sizable community and population, and yet we still encounter a lot of socioeconomic challenges and barriers. And so when I think about what are those top three, the first one that we often find in conversations that we have through our community listening tours, where we go into communities on the ground, work with grassroots groups or community leaders, we often hear healthcare for all. So we're in the middle of a once-in-a-century pandemic, and we saw some of the same challenges with healthcare access pre-pandemic, and those challenges have only been exasperated. And especially for Latinos, one of the main barriers is that immigration status is often tied to access to our state's Medi-Cal system. So Medi-Cal is a program for low-income Californians at a national level. It's called Medicaid. And we've made decisions, right, as decision makers, policymakers, that undocumented folks aren't going to have access to healthcare, preventive healthcare services. And LCHC has been a longtime champion of the Health for All campaign. Some good news out of some of the budget deliberations this year with the legislator and the governor's office. There is, for the first time, an investment in Health for All seniors. So it's looking very positive that our senior population, which were one of the most impacted communities and age groups with COVID-19 and the pandemic, we're going to invest in it. And, that means a lot. As we think about the future of healthcare reform, let's get everyone covered. Let's get everyone access to healthcare. It should be a human right. It shouldn't be a privilege of a few. And the thing about healthcare is, if we don't have healthy communities, folks can't go to work. They can't go to school. So we want to have a productive, functioning democracy, society, a productive California. We need folks covered. So that's the first issue. The second issue that we see in communities is just the lack of investment in what we call the social determinants of health, public health. I was trained in public health, so I have a sweet spot for it. There's been decades of disinvestment in our public health infrastructure. I think we saw that with the pandemic. It's almost like this virus came, and oftentimes, stretched local public health departments that were underinvested in for decades weren't ready necessarily they weren't ready with the workforce, with the data infrastructure to be able to know what's going on, to be able to effectively respond. And so LCHC has been looking at strategies and investing in our public health workforce in particular. And the aspect of it is that public health can be done in a silo, has to be done in partnership with community-based organizations like LCHC, so many grassroots groups on the ground. So we're a strong champion of the establishment of California's Health Equity Fund. The purpose of the fund is to invest in these local health department and community-based organization partnerships to address the social determinants of health, all of the factors outside of the healthcare system that we know make communities healthy, from access to affordable housing, access to healthy food. So really investing in that aspect of community health. And the third thing that I would just share, and this extends beyond the Latino Latinx community. It's for all communities of color. We really need to address historical racism in California that permeates all of our systems, organizations, from the macro to the micro level. Our good friend Senator Pan has been leading the effort on establishing the Office of Racial Equity to really look at what are our organizational practices with the state and how are we really meeting the needs of a multicultural, diverse communities across the state. We need to contend with the fact that we have a history of racism, of slavery and genocide against Native peoples here in California. And we can't get to health equity if we don't talk about that and we don't address it. So those are, 3 issues, major issues. It's going to require all of us to be a part of that, the health equity movement. And LCHC has been leading with our coalition partners to ensure that we move forward in the right direction.
And thank you for that leadership and for that blueprint of those 3 points themselves, like, gave us a great place to start, right? So you talked a bit about how the pandemic had affected the health of the Latinx community. Even before the pandemic, we saw the previous administration launch an attack on the Latinx and undocumented communities. How did the prior administration affect the well-being of these communities, before the pandemic and then even coming into the pandemic?
Yeah, I think this is another kind of a personal point. I was working in healthcare. I was still in academia, and really what really motivated me to lead and come over to lead the Latino Coalition was the election of our former president and all of the vitriol, the hatred that came out of that, and ultimately the policy decisions that were made under the prior administration. I'll just highlight one that really caused a lot of fear and a chilling effect with Latino and immigrant communities, which was the public charge ruling. So the Trump administration basically wanted to make it harder for those community members that were already here to access benefits that they previously could, healthcare, food, housing benefits, all of these federal programs that our communities rely on. And what this caused was what we call a chilling effect across communities. So not that there wasn't a chilling effect before, but it only magnified it. And so we were hearing from community health centers that patients, entire families weren't showing up to their visits, to follow visits, because they were just fearful if they access healthcare that they deserved to access, that they would be rounded up by ICE, right? Or they wouldn't be able to apply for legal status here in the US. And so all of this caused challenges across healthcare and public health. And the thing about this is, when we think about public health, and when there was a change in administration, thankfully, with the last election, and then the pandemic hit, right? So on the one hand, we're telling immigrant communities and communities, Latino communities in particular, we don't want you to access services, right? We don't want you to come to the clinic, stay away. But then we're in the middle of a pandemic where we want folks to get tested, right, for COVID so that we can do the appropriate contact tracing. So how do you effectively manage a pandemic from a public health perspective when you just told, the messaging and the policies are saying, you don't belong, we want you out of here, but at the same time, we know you live here, we know you contribute to the social fabric of our communities and society, and now we want you to get tested, and now we want you to be contact traced. It doesn't work that way, and so it's been multiple years of fighting against the public charge ruling and some other draconian policies. They wanted to dismantle the Affordable Care Act, which, by the way, the Affordable Care Act, often known as Obamacare, was the largest expansion of healthcare since Medicare and Medicaid were established back in the 70s in the United States. And for Latinos in particular, it was the greatest expansion. In California, we saw a 50% drop in the uninsured. So it was a huge, blessing for Latino communities. And the former administration said, we want to dismantle this law. We don't want, healthcare for immigrant communities, for Latino communities, and all communities that need access to healthcare. I think I was really personally energized and felt a lot of hope with all of the organizing that happened on the ground, grassroots groups, everyday people that stood up to some of these really hateful policies like public charge. And I think we were ultimately successful. Public charge, in the first 100 days of the new Biden administration was repealed, but now we have to do the work of spreading the word and educating our communities that that policy is no longer the law of the land.
Mm-hmm. So let's talk about vaccine rollout in the Latino community for a minute. What barriers are you seeing to accessibility within the populations you serve? And then what steps is California taking, or should California be taking, to ensure equal access to the vaccines?
Yeah, a really great question, really timely. I think we were all of us, right? We weren't expecting a vaccine to come so soon. So it was almost like a lifeline, a light at the end of the tunnel of what's been a really difficult year for a lot of communities, Black, Indigenous, Latino, other communities of color that were most impacted by COVID-19. And so I sit on the state's Community Vaccine Advisory Committee. So we've been providing input. It's a broad group of stakeholders across the state to provide input on the allocation. And to be honest, it's been a challenge. It's been a bumpy road. We're creating, a new system of rolling out a new vaccine and trying to make really difficult choices on who is prioritized among 40 million Californians. Some very difficult decisions. I think we won some important initial allocations. So after healthcare workers under the phase 1B, if you recall, some essential workers were prioritized, especially our food and ag workers. So we were really grateful that farm workers were prioritized. They've been working every day to make sure that we're all fed during the pandemic. And that was a huge win. But then, that's just the allocation piece. To your point, allocation doesn't necessarily mean access. So access means, working with the right players at a local level and combating a lot of the mistrust. I talked about public charge. That mistrust in government and in systems still exists. And this is why, the state of California, to its credit, partnered with CBOs, community-based organizations. They partnered with Trusted Messengers, our group, other coalition partners that we work really closely with to really get the word out and the messaging at a local level and be able to overcome some of the barriers. But that being said, still a lot of challenges. In the initial days of the vaccine rollout, for example, you had to go on myturn.ca.gov, right? You have to, and what does that mean when you have to set up an appointment online? It means you have access to the internet, right? It means you have the literacy, the digital literacy skills to be able to sign up. And so we really provided an input to the state to think about what are some walk-up appointments that could be had, or working with CBOs to set up special vaccine mobile walk-up sites in neighborhoods that have been the hardest hit. One of the biggest, I would say, structural policy changes that the state of California advanced, and this was in collaboration with public health advocates, health equity advocates. In early March, they announced that the state would adopt what's called a health equity metric. And without getting too technical here, I am a recovering academic. Without getting too technical, basically they adopted a metric that prioritized vaccines to the 400 highest need zip codes in the state. So, zip codes with the most poverty, lowest, educational attainment, had a lot of, those neighborhoods that we know were hardest hit by COVID-19. And, I think that policy change, when you look at the numbers of vaccines that were being allocated, you saw a reduction in the disparities, and you saw more vaccines at a local level go to those zip codes that were highest needs. And by virtue of that, we saw increased allocations to Latino communities. That being said, I looked at the figures just before this call. Something like 26% of those vaccinated so far are Latinx. So, I mentioned earlier, 40% of Californians are Latinx. So we still have double-digit disparities. There's still a lot of work to be done. But, we're working really hard, trying to get the word out and supporting the state and providing that input so they know how to best reach our communities, and, working with CBOs. Also ensuring that all the information that's going out is in language, is in culture. And by the way, one thing about the Latino community is that we're not a race, right? We're multiracial. We're also multilingual. So for example, a lot of the farm workers, they may not speak Spanish as a primary language. So you have to look into providing services, materials in indigenous languages. And so providing that insight to the state so that it can better serve our community has been really important as we've rolled out the vaccine.
And while we're talking about it, what message do you have for community members who may be hesitant about getting vaccinated?
Yeah, so a lot of hesitation. Just to start out, and I think this is part of cultural humility. If someone's hesitant, right? I almost don't like to use the term, right? Because I'm aware that there are systems in place that make, folks distrustful of systems, right? So I think we need to start out with where people are at, asking the questions, answering those questions. There's a lot of good science behind it. As a public health professional, I've looked into the research, looked into the data. The vaccines are safe and effective. They're not going to implant a microchip in you. And so combating that misinformation is really important. But I'll just say more recently, what we've been hearing on the ground is that there's been a lot of challenges when you do go to a vaccine site. I've done it myself. They do ask you, right, for your identification. They do ask for an insurance card. And so the biggest message I want to get out there is the COVID-19 vaccine is free for everybody, regardless if you're insured, whether you have health coverage or not. And it's available to everyone, regardless of your immigration status. And it's not going to affect you, your family. The information is personally identifiable information within HIPAA regulations. It's not going to be shared with ICE. So, go out there, get your vaccine. If you have questions, reach out to those trusted CBO, community-based organization partners from trusted sources, and get your questions answered.
All right, Dr. Reynoso. So I got one more question for you.
All right.
It is the question that I ask everyone that comes on this show. Where are you finding your joy these days?
Really love this question. It actually reminds me of my undergrad days at UCLA. I had a professor, one of my favorite professors, Teo Ruiz. He would always write at the end of every exam or paper assignment, "Do not postpone joy." And, I've really taken that motto, as something to live by in my life. Life is hard, but we have to find joy, in the midst of tragedy. For me, I think what gives me joy on a personal level is being able to still call up my parents, family members, many of them who were essential workers. We all survive. We're all survivors of the pandemic. And so being able to just have my family around me after a once-in-a-century pandemic brings me a lot of joy. I think at a more policy systemic level, I've felt so much joy just hearing the acknowledgement of what an essential worker is. For so long, there's been so many categories of workers: farm workers, restaurant workers, domestic workers that have been honestly invisible to policymakers, decision makers, to all of us. We've taken them for granted. And I think if anything with this pandemic, taught any of us is that, they're essential and they should be compensated and they should be acknowledged. Their dignity of work matters. So that brings me a lot of joy. I think we're seeing a shift in the conversation, and I'm hoping some policy actions to recognize that.
Oh yeah. Let's get all of our essential workers paid like they just put all of us on their back and carried us through a global pandemic, man. It's so much love for all of those folks out there. And so much love for you. Thank you for coming through and having the conversation with us and offering so much insight into the Latinx community and what's going on right now in the wake of this pandemic. We'll have to touch base again on the other side once we're completely out, and we'll talk to you a little bit more. But thank you so much for who you are and all you do, and just for coming by and chopping it up with us today.
Thanks for having me.
That brings us to the end of another episode of Masked Up. We want to thank the half the internet that tunes in every week. We couldn't do it without y'all. I'm Andrew Defy. As always, shout out and big thanks to Netta, Allison, and the rest of the Masked Up show crew. Like Mozzie said, health is wealth, and I need my bag. Remember, y'all, health doesn't come from a pharmacy. Till next time.